Strokes are a leading preventable cause of death and disability worldwide. To prevent stroke, 3 of the most important factors may be diet, smoking cessation, and blood pressure control. The Global Burden of Disease Risk Study found that 90% of attributable stroke burden relates to modifiable risk or factors under the patient's control. About half of all modifiable risk relates to inadequate consumption of 2 things, fruits and vegetables. The more fruit and vegetable consumption, the lower your stroke risk. For example, stroke risk drops 32% for every 200 grams daily increase in fruit. This is about an apple a day. There's an extra 11% reduction for each equal portion of vegetables daily. 3 cups of green tea were associated with an 18% reduction in stroke risk. In a major study, 1 ounce of nuts daily cut the 10-year stroke risk by 46%. A quarter teaspoon of garlic powder beat out placebo in preventing the thickening of the major arteries in the neck leading to the brain. A final note of concern to all in general, but to vegetarians and vegans in particular. Adequate B12 consumption is critically important in relation to elevated homocysteine levels believed to be a factor in elevated stroke risk in plant-based eaters. A fundamental shift in healthcare is underway. There's a new focus on patient-centered healthcare. Why? When the focus is on you, better health outcomes are produced at lower cost. Above all, you want to be rid of the chronic condition. You don't have time for the culture of medicine to transform from doctor-centered to patient-centered. Writing another prescription won't prevent it. Scheduling a risky surgery won't reverse it. You want someone to show you exactly what to do, especially when you leave the clinic or hospital. Right now, you're left to figure it out on your own because the system is not focused on you, the patient. What we offer is different. We show you exactly what to do each day. Yes, daily. There's no guessing. There's no we'll see you in 90 days. We're with you every day via text messages. Imagine if you were meeting each evening with your medical team to plan out the next day, to check in each morning, to have access to them from the palm of your hand, to help you make the best decisions, to keep you on track, to support you if you stumble. This is what we consider patient-centered now. This is how we move the needle on your condition together in 90 days. Your condition won't go away magically on its own. You can't wish it away. You must change very specific health behaviors. We help you figure that part out together.